Well, good morning everyone, just letting everyone come in and take their seats. It's wonderful how immediately slow Zoom is when you open the doors. If you just come in and set yourself up and be comfortable, we're going to be starting in just a moment. Okay. Well, good morning, everybody, or good evening, as I should say for everyone else who's joining us from other time zones. Today, we're pleased to bring the next in the series of our thematic innovation ecosystems, looking at the whole topic of skills and skills for health. For those people who've not been around for a while, we've been doing a number of these targeting both skills for carers and citizens. And today we're looking at that very hot topic of skills for frontline workers. The idea behind these thematic innovation ecosystems is we're bringing and showcasing both need and solutions. So that's what we've got in great big bucket loads today. We've got needs and solutions from across Africa, India, Europe, Australasia, and that's, I think, a good testament to the reach of our community. Just a little bit about who we are. My name's Andy Bleed and I'm the Communities Director for the ECH Alliance. We're a member organisation. We mostly represent lots and lots of not-for-profits, universities, hospitals, government bodies, etc. If you're interested in joining us and taking part in more of these, we'll stick a link in the chat function below. We bring many of our health stakeholders together in what we call ecosystems, and this is one of them. The idea is around matching both need and solution with patients and citizens at the centre. And the idea around that is around transforming healthcare, breaking down silos, and also creating economic growth. We've set up a series of these and established a series of these ecosystems, some of which are here today from Australia in Melbourne, and also in Denmark with our colleagues from South Denmark. But what's great about our ecosystem network, you can see where all of those are located here. Some of you may be in areas where these are already taking part, and if not, let me know. We can help you set one up. But the idea about that collaborative network is we've since then built a series of what we call thematic ecosystems, including the one today on skills for health. Looking at a thematic area, topic by topic, again, matching need and solution. So what we're looking at today, as I said, is around the area of frontline workers. Very much people talk about the fact that there's skills deficits around using digital health skills in health and social care nowadays. And so what we've brought today is both examples from industry about how they've addressed their own specific needs, from very large training networks across both Africa and India, but also best practices that we've seen from Denmark and Australia. So I'm going to stop talking and I'm going to hand over to my colleague Karen, who's going to tell us about what we're doing today and also give a message.
Thanks, Andy. I think you've done it for us. I would actually like to start by giving an acknowledgement of country. So this is a traditional thing that we do in Australia, and it's where I would like to acknowledge the traditional owners of our land. And where I am currently today is to acknowledge the Wurrung and Burrung people of the Eastern Kulin Nation. I also come from Luthawita country, which is the Palawa people. So Luthawita country, you may know as Tasmania, which is a small island off the bottom of Australia. And today I'm in Eastern Kulin country, which is in Melbourne, Victoria. So we welcome you to this event, and I welcome you as an Australian to this event. And I'd like to pay my respects to our elders, both past, present, and those emerging. So I and Caroline Studrick from Denmark are both pleased to host this event as chairs of the Skills for Health thematic ecosystem. This is the third event that we've held together, but it's the next one in our series, the skills needed for the frontline worker. If you're interested in our past events, we do have a website and we will make that available in the chat so you can have a look at it. But our last event was looking at the skills needs for citizens and carers, and that was a really interesting event. And I anticipate there will be another interesting event tonight. So I'd like to invite Caroline to talk also a little bit about the event and talk through the polling that we're going to have happening throughout this event as well.
Yeah. Thank you, Karen. Yeah, so as with the other events that we've had, we like to start with investigating what is the need. So when we're looking at frontline workers and skills for health, what is the need? That's what we'll start with today. Then we'll look into some best practice examples. And as Andy said, that will be from very different places around the world. And then at the end, we'll try and talk about how we match the needs and the solutions in a discussion with all panelists. And throughout the event, we will do a few polls just to involve all of you guys to say, what do you see from your end, from your ecosystem, from your area, so we can try and see what it's like across countries here. So that's what we'll do today, but we start with you, Karen.
Thanks very much, Caroline. So our events, we break into 3 sections. What is the need, what is needed, and what does good look like, and then how do we match needs and solutions. And so for our very first speaker, I'd like to invite Randy Lehman-Bosen, who is the Innovation Consultant at Health Innovation Centre of Southern Denmark, to be able to present the needs of the frontline workers across Europe.
Thank you very much, Karen and Caroline. My name is Randy Bosen, and I work with Caroline and Linda and some of the other nice people here today or tonight. It's today. This is morning in Denmark, I can tell you. I would like to tell you about a research project that we've been doing on an Erasmus Plus project called Deliver, where the focus is on developing material for training of digital skills of healthcare professionals and healthcare managers. So we're actually in the middle of this project. We have done a large need assessment to find out what are the actual needs of healthcare professionals or frontline workers when it comes to digital skills. So we wanted to find out what is the actual skill level. That was one of the things we really wanted to investigate in. And we also wanted to find out what is a mindset and what is the attitude of people when it comes to digitization and digital tools. So we did a survey. We did a survey with around 400 respondents from the 4 different countries of the project, which are Slovenia, Italy, Catalonia, and Spain, and Denmark. And we also did qualitative interviews with actually 74 healthcare professionals and managers. So quite a large need assessment across these countries. And the healthcare professionals were very diverse, but we had most nurses among our respondents, just so that you know. And what we found out was that, actually quite surprisingly to us, the skill level, the self-assessed skill level was quite similar across these 4 countries. People generally assess that they have high skill level when it comes to using the digital tools that they have in their daily life, communicating through digital tools, and also when it comes to data security, information security, they feel quite secure. Where they score themselves low, or where we can see there is a low score, is when it comes to the mindset related to keeping up to date with emerging technologies, implementing technologies, and awareness of your own shortcomings when it comes to using digital tools. So the reflection level. The managers were a bit better on this compared to the healthcare professionals in general. But again, I guess their role is also to be a bit ahead when it comes to new implementations. So that was about the skill level. So when it came to attitude and mindset, that was very much in our interviews where we were talking to people. We asked about which negative effects do you see of digital technologies in your daily life? Which positive effects do you see? We also asked much about which problems do you see in relation to implementation of these new digital tools, and where do you see that there are potentials for improvement of digital skills of yourself and your colleagues. So there was agreement, quite a lot of agreement about what are the negative effects of digital technologies in our daily life. Administration, registration, which takes time away from the patient, was pretty general. And all these new changes, the fact that there are new technologies, new workflows constantly, is seen as a burden for many, especially the older generations, but also some younger. Positive effects were quite different because the digital solutions in the 4 countries were different, but faster and easier access to updated information due to these uniform and centralized digital documentation tools was quite general. The ability to share information across providers, better overview, which creates an optimization of time for the healthcare professionals, and faster and better patient care, actually, of better quality, with higher data security. That was actually quite general, even though there were some differences across the countries. So which problems are related to the implementation of digital technologies? And here, inadequate training was so general. As the healthcare professional and managers say, we don't have the time, we don't have the resources necessary to really get acquainted with these technologies that we need to use. There is no generally there's no clear structure for the training of digital tools. It's self-training, it's learning by doing. Maybe you have some peer support if you're lucky. And generally training is designed locally by super users or IT staff or ICT staff. And then also the organizational structures of the organizations, the hospitals. I forgot to say, we were both in hospital sector, so secondary and tertiary sector, and also in primary sector. So in all these sectors, there was a problem of organizational structures that do not necessarily facilitate implementation of these technologies. So very much on the manager's shoulders. And then the last thing was mindset. Mindset was seen as very important. The fear and the reluctance to replace contact with the patient with a digital technology. So all this led to an awareness that the potentials of the existing tools is not exploited. So where do you see potentials for improvement of digital competencies? And here, people, the healthcare professionals answered what they actually found most important in order to use digital tools. And here it was attitude and mindset. Even though we asked which skills are necessary, they answered, you need to be open-minded. You need to have an interest in technologies. You need to be curious, patient. You need to be courageous. You have to change the way you think. And this was across countries. As one said, employees must dare to embark on digital technologies. If you have the will and the interest, you will acquire the necessary competencies. I think this was a quite good statement. And also, so this was the most important across the interviews. And also the reflection on the value of technology, not just using it just because it's there, but reflecting on where it should be used and where it shouldn't be used. And then awareness of your own shortcomings was quite necessary. So the needs were quite similar across countries, these 4 countries, and almost 500 healthcare professionals and managers, better training and the ability to practice the tools you have, focus on mindset, which is actually the role of managers and organizations to facilitate why digital technologies make sense, and create better conditions for the healthcare professionals to get to know these technologies and reflect on how to use them. And all this is really important for them to feel competent in using these technologies and to be able to work efficiently in this more digitalized healthcare sector. So that was our main findings. Very short.
Thank you very much, Randy. So I encourage everyone, if you have any questions for our speakers, please do put these into the Q&A box. You can see down the bottom there is a section that says Q&A. Please post your questions there and our speakers will respond to them, and there will also be an opportunity later on to ask our speakers any questions that you have. Our next speaker is Teresa Morrison, who's the Director of Clinical Services and Training for Connected Health. Teresa will be talking about the needs of the industry. So welcome, Teresa.
Hi, everyone. Good morning or good evening. I'm in Belfast here, so it's good morning for me. So I'm the Director of Clinical Services and Training in Connected Health, and Connected Health is predominantly a home care company. We deliver care throughout Ireland, the North and the South, and also in England and Wales. We do a lot of, more recently, virtual and digital care, but the majority of our frontline workers are social care workers, and that is around approximately 1,000 social care workers working in our local communities throughout Ireland, South and North, and England and Wales. We've been on a great journey with Connected Academy, which is our training academy, and that was identifying the need from way back 2017 when we set up. And as we have grown and the months and the years have come on to today, 2022, we've recognised the need has changed dramatically. Bear in mind, we had COVID in the middle of that, but the range of need is growing because the growing demand of social care is growing. Social care itself is growing because we have more clinical need of those people living in the community. We have more supported services of young adults with challenging needs living in the community. So the need of the skills for our frontline workers are growing at a fast pace, and it's people like ourselves that need to work together and meet that growing demand. But we believe our frontline workers deserve to receive the most appropriate skills needed to do their job effectively. That's why we need to identify the population we're delivering the care to at our early point, and identifying the talent and developing the training program to meet the needs of our clients, and then add in with that technology. We believe that the skills are very important to do the job, but we also believe that we should provide our frontline workers with accredited programs, training programs, which they can feel valued in achieving and feel that they are reaching an outcome to do their job the best they can. We partnered with Open College Network, and we have created a number of endorsed and accredited programs. Likewise, the ones you see on the screen, we have a level 1 endorsed course initially, which is for a safe for care practice in the community. This can be rolled out in hospitals and also throughout the person's home, also residential facilities. This program is for those coming into social care initially, or those who have worked in social care for a long period of time. It's an endorsed course which gives them the skills to do the job as and when they get out with their first day of employment. We've created the courses right up to level 5, which is a diploma in management in health and social care. And it gives our frontline workers a career pathway and a career progression, which was never really recognised within the unprofessional skilled workers within health and social care. So we pride ourselves with that, and it has given us the opportunity to employ people, retain people, and provide the skills to meet the needs of the growing demand within the community. More recently, with the innovation of healthcare and connected health working quite closely throughout the NHS, HSC, we've identified a digital healthcare program. We're working with intelligent care, and we do believe that the future of healthcare needs to have digital care built in. It needs to be intelligent.
Can I just ask, can you just press the share screen button, because we can't see your slides at the moment?
Oh, sorry, apologies.
I could see you reading. I thought, I can't see. No worries. I'll let you know when they come up. Green button on the bottom. Share screen.
No, Andy, it's not coming up. I have. Is that it?
No, not yet. No.
No.
The green button at the bottom says share screen, and it should
I'm hitting that. It's bringing me the settings. Bear in mind, I did get a new Mac recently, so it may not be allowing me in terms of the system preferences. Let me just try to.
And if it doesn't work, we'll send them out afterwards so people can see. But
yeah, apologies. It's not.
Let's carry on as we were, and we'll share the slides afterwards.
Okay, well, what we have recognised is the need for digital health throughout, as we are never going to be able to meet the growing demand of social care within the community. We need to meet digital and physical care and be intelligent about assessing that. In Connected Health, we have a living lab and we trial a lot of digital devices. What we have recognised over the past number of months is that we're in a very good position to demonstrate a number of digital devices with our current clients, provide the evidence of how beneficial or how necessary that is with their own person-centered needs. And it's given us the ability for Connected Tech and Connected Academy to come together and create training programs, which has allowed us to mobilize devices right away. There's no hold on implementation, no hold on setup, no hold on training for our existing frontline workers to put those in place. We have found that's been remarkable for meeting the growing demand across services right across England, Wales, Ireland, both south and north. And we feel that coming together as a workforce, a social care workforce, embedding skills within frontline workers across physical care, being intelligent and incorporating digital care is how we need to see the future of health and social care. And we believe innovation contributes to all of us coming together, sharing our views, sharing our programs, and liaising with each other and implementing that right across the board worldwide.
Thanks for that, Teresa.
Okay.
Wonderful. Thank you very much for your presentation, and apologies, the technology wasn't working. Sorry, Andy?
No, that's it. I'm fine. Carry on, please.
Okay, sorry. So yes, my apologies that the technology wasn't working. As Andy said, we will be able to share the slides after the session, and we are answering the Q&A questions in the chat box that you can see. So thank you very much to those that are answering these. We are not able to present our next speaker just yet. We're just having some technical difficulties getting her into the session. So whilst we sort this out, I'd like to refer to our first poll question that we have. So we'll put the link to the poll question in the chat box that you'll be able to see. But our first question is looking at what knowledge about the needs for digital skills for frontline staff are we missing? So we've already had a post in the chat, in the Q&A section from Lee Fisher. Thank you very much for your comment in there about around teacher resistance to technology and asking the question about how we overcome practitioner mindset around resistance to technology. And Alan Whiteside as well has put in a question asking, and we're just responding to these now, about the issues around digital skills illustrating lifelong learning. In the chat, I can see that Adriana has just posted in there the link to the Padlet site. And when you go to the Padlet site, you'll see it is this lovely green, yellow shades in there. And you'll be you'll be able to post your comments in there whilst we have our next presenter speak. So Anne
is here. Anne is here,
yeah,
Karen.
Thank you.
Right.
So our next presenter is Anne Livingston, who is the Executive Lead for the Aged Care Industry Information Technology Council. And Anne, welcome. She is presenting tonight about the needs of the aged care professionals. Welcome, Anne.
Thanks, Karen, and thanks, Andy. I'm presenting from very cold southeast Queensland, 25 degrees in the middle of our winter here, and I'm on Quandamooka land, the land of the Quandamooka people. First, I'll tell you a little bit about the Australian Aged Care Industry Technology Council. We're a council that brings the interests together of innovation and technology across our two peak organisations in aged and community care, being Aged and Community Services Australia and Leading Age Services Australia. The council's got a long and proud history of advocating for the role of technology and digital care and support. and how that will play out in providing higher quality and more personalised care to older Australians and their families. We've spent over a decade collecting evidence and benchmarking digital maturity of the sector. This has recently included completing a landmark work in a couple of years back now on developing a technology roadmap for the Australian aged care industry, and spending much time with colleagues internationally in benchmarking that roadmap. We've completed the first national benchmark of the capabilities and capacities of our sector to deliver on our digitally enabled and digitally enhanced aged and community care sector. And we've recently been spending time drilling down on particular issues, including items like the use of clinical care systems across a range of care settings. But what does underpin all our considerations in our work is the need for a quality and skilled, digitally enabled workforce. And we've got current workforce statistics that are both alarming and concerning, but I think they're mirrored in many other countries. Our recent Royal Commission into the quality and safety of aged care really identified significant issues around shortfalls in residential and community care. But they also suggested our workforce issues were exacerbated by both the predominance of older workers and the deficit we have in attracting younger workers to the sector. Our medium average age identified for residential aged care workers or long-term care in other countries is 48 years old. And for community care, it's actually the average age is 50. The poor digital literacy of this older workforce has been a critical issue for us as a council. Going forward, though, we know that we're facing more critical shortages. A recent report from the Australian Centre for Economic Development indicated that we're facing at least 110,000 direct care worker shortage unless urgent action is taken to boost the workforce right now. The shortage will balloon into about 400,000 workers by 2050, and with a need for about 17,000 more direct workers each year is just to meet basic standards of care is playing out as we speak today. Coupled with that, we know at other levels, professional workers are turning over at rates of 40% in the last 12 months. Middle management about the same, around 42%. And frontline workers, really concerningly, before Christmas, the stats are around 50%. But then we've had COVID and we've had COVID and we've had COVID, and we've had recent reports after Christmas with the recent new wave of COVID, up to 65% staff shortages in some residential care facilities. So we've been measuring the acceleration of digitalisation of interactions with older people and their service providers through COVID. We're going to be looking very closely at whether we can maintain the role that technology and digital care has played during the forced innovation we've seen through COVID. But our challenge going forward is how we can keep the momentum of digitalisation the pandemic has forced us to embrace. We've also got the challenges of delivering to very remote and rural communities and very isolated communities. So perhaps considering all these factors, we need to talk about a digitally enabled workforce, but also the role that technology can play, not only in augmenting and supporting that workforce, but perhaps substituting specific roles. And I refer predominantly to the roles that might be dull, dirty, dear, or indeed dangerous. And we see many of those haven't been transformed in our sector. Our recent research, particularly around the capacity and capabilities of the sector, have really shown us that Australians older Australians want and need technology in their service provision, but also that technology is actually critical for service providers to actually provide more high quality assistance to them. We do also know that we've got lots of deficits in the opportunities that technology provides to our workforce, certainly across telehealth and telecare, AI, surveillance and monitoring technologies, data analytics, and more broadly around the implementation of smart home technologies across settings. But we need to really vastly improve the availability of our digitally enabled workforce. Recent work that we've done with our National Premier Research Centre, our CSIRO, found that in analysing the competencies of workers that we have in the sector, of the 400 units of competency that underpin training of aged and community care workers in our country, the number of mentions of data over those 400 units were only 3, and there were only 2 mentions of digital care and computer skills. So if that's a training base we're coming to, we really need to cultivate many more opportunities for our workforces to be digitally skilled and upskilled. And I was reading and reflecting on a recent blurb, Andy, of one of your recent sessions that indicated that our country's ability to captivate a digitally skilled and innovation-ready workforce really underpins the country's national success in digital health and aged care. And I think that we're seeing that play out in our the needs of the growth of our aged and community care sector, but also the real gaps we're identifying in digital skills and digital availability of digitally skilled workers. Thanks, Kieran.
Thanks very much, Anne. That's great. So we have heard a lot during this session about what are the needs in the frontline the skilled needs within our frontline staff. And we've had the Padlet poll happening in the background. We've had a number of replies on there, and you can continue to post on this Padlet site. But is Adriana, is that something you're able to share on the screen so we can just have a look at some of those responses?
Yeah, I can share that.
Thank you very much. So whilst that's coming up, and you can also have a look at that on your own screens, and Adriana's just posted the Padlet link again in the chat box, not in the Q&A, but in the chat. And we can see some of the themes that are already emerging include this, how do we actually upskill the frontline workers within rural and remote locations so that they, both acknowledging that being able to access technology within those areas and connectivity, etc. But then quite often training needs aren't, the way that we actually deliver training is not available to people living in rural and remote locations. I know here in Australia it's a real issue because we can have hundreds of kilometres between a community nursing outpost, for example, and a capital city where training is actually available. How do we self-assess the digital competence of staff? And we know some countries are doing really well in this area. They have surveys that staff can undertake to be able to assess their capability or their digital capability levels, and then make recommendations of courses they can do. And Health Education England's a really great example of that. Here in Australia, we've only just launched our education and workforce roadmap, but we haven't progressed a lot further in that area. Some other things that have come up in here is one really good one that Andy actually posted. I liked this one, was about this, what's the perception of staff about the point of increasing skills. So we need to understand that level of interest in developing skills. And I know certainly in my discussions, I do a lot of workforce research, and some of that research has indicated staff feeling that it will get to a certain level of requiring digital capabilities, and they just plan on leaving the workforce as opposed to continue to increase, their skills. For them, they're at an age where they don't feel the need. So what do we do? How can we actually retain these workforces as well, and continue to use them in meaningful ways? Well, heading right the way over to the right-hand side of the screen, there was another one over there around the innovation strategy, and these opportunities and interests to co-design and adopt technology. So when we're looking at developing these technologies, not just building it for a purpose, and sometimes building technology not without a purpose, but also start considering about how it's going to be used and what skills do we actually need of the end user, and designing technologies with that in mind as well. I'm going to leave it there because of the time. Thank you very much to our first three speakers for a great introduction to the session. We look forward to more questions coming through on the Q&A. I'm going to hand over to Caroline, who is going to be chairing this next session.
Thank you, Karen. Yeah, so now we move into what does good look like. So what best practice examples do we have that we can have a look at together? And we'll show examples both from Europe, from Africa, and from India. So now we're really sharing across the world. So first off, in this section, we have Louise Simsik from Denmark, who will talk about how to help midwives do prenatal classes online instead of the physical ones. Over to you, Louise.
Thank you so much. Hi, everyone. My name is Louise Simsik, and I am in charge of our prenatal preventive care measures at the hospital in Kolding, which is part of Sygehus Lillebælt in Denmark. We have pre-COVID, we already could see that there was a different need in our patient groups. The generations of people that start families are demanding different solutions, different things than we so far have been giving them. So the thought of going more online and digital solutions had already occurred to us, but what COVID brought, which was positive, one of the only things, I guess, was that it created a very urgent need to find these solutions right away. And we were lucky to join a project with our Health Innovation Center of South Denmark, where we could get these webinar solutions started, because we have lots of very talented and skilled midwives, as all other health professionals are, but their focus and their skills are mainly focused on the patient care. And the digital and technology knowledge is not, you could say, as great, at least not for everyone. So this offered a challenge, but a challenge that our staff was very much eager to take on. We gathered a small but very experienced group of midwives who were mainly experienced in teaching birth preparation classes. And it was very moving actually to see how they jumped on the task of finding solutions and trying new things while being extremely insecure about how to and to find themselves in a new setting. Because for health professionals, you need to find a new way of feeling comfortable and using your skills to reach the patients that you feel responsible for. And so I think for the midwives, the biggest challenge was to actually feel comfortable. Once they had gotten the technical skills and learned how to actually physically do it, they had to get into the process of feeling comfortable. And until that happened, we had a period of time where we maybe didn't feel like what we offered was as great as what we could have when we physically had attendings for the birth preparation classes. But the midwives got more and more comfortable and had technical support along the way. and now are actually very excited for this solution of the webinars that we host. What we found was that, to begin with, we thought that the webinars would be a temporary solution during COVID, but COVID brought so much anxiety and worries throughout our families to be, that this was a very easy way to access them and to give them the information that they needed to not be scared, to not be frightened. And the midwives loved that they could reach a much wider group of patients than we previously had been able to. Our hospital is located with a huge area around it where all our patients are living, to where if we have the attending classes, they need to travel quite a bit sometimes to attend. And this way we could actually ensure that we could reach a much wider group of our families. Also, we found that some of our more vulnerable families were able to take part in all the information that we are so eager to offer during their pregnancies, which meant that people with social anxiety or other challenges that makes them not attend usually these classes were able to actually log on online and feel safe and get the information that they needed as well as the other. So we felt like we optimized the equality of of what we had to offer the families, which felt great, and which is also why we have continued the webinars now. I don't know if we could completely say post-COVID, but at least things are looking up. We did also find some challenges with these types of webinars, because the very heavy information load that we want to give our families work wonderfully on the webinars, but we also have some more active and physical preparation classes where we focus on the pregnant body and preparing your body for delivery. And that turned out to have quite a bit more challenge to in a professional way, send that message to all our families online. We are used to seeing people's reaction. We're used to engaging them in the exercises. And now the midwives were in front of a camera doing exercises, feeling very much alone and not knowing, are you with me out there? And it was quite a bit different from what we were used to. And so that is also an experience that we have taken with us now, to where we have opened up a little bit again for attending classes, but actually only for those physical classes of birth preparation, because they still make sense to do in physical attending. So those are the only ones that we host that way, and all the other stuff we still have as webinars. One of the other challenges that we're still facing is that although we have our small group of midwives have gotten very good at the technical knowledge of the specific webinar setup, but we don't have a IT support group just for us. We have a general IT unit at the hospital that are wonderful and helps us all they can, but they are not necessarily available at the moment of us hosting the webinars. So one of the challenges that we face is that the midwives are having to figure out the problems as they go along. And we have a setup where we have one midwife teaching and one midwife checking the chat and answering questions, and also trying to solve people's technical problems. And we have a few things that we know what to do if this and that happens, but once it gets different from the common problems, that we simply don't know what to do. And we don't have that same hotline available for when we're hosting the webinars. So that is still a problem that the midwives are facing, that not only is frustrating in the situation, but it also, what frustrates them mostly is that it comes across as unprofessional. And all healthcare professionals want to offer good information, professional information in a professional setting. And when we can't offer the technical support, it becomes unprofessional. So we're still working on that part. So Yeah.
Thank you, Louise, and also for sharing some of the things that still are challenging, that we can also share these parts. Yeah, so now let's get on to another part of the world. So see some best practice examples from Africa by David Montgomery. Over to you, David.
Good morning. I'm David Montgomery. I'm the CEO of the WCEA. That stands for World Continuing Education Alliance. I'm just going to share a deck and introduce myself and talk to you about our experience in Africa. Hopefully you can see my screen now.
That's coming now, yeah. You're on.
Perfect, perfect. So in 2019, I joined the WCEA as the CEO. Our goal and our motivation was to really improve healthcare outcomes in Africa. The WCEA prior to 2019 was a pure play technology company, but we believed that our learning management platform was an essential part to delivering education reliably and effectively in Africa. So through 2019, we assessed the landscape and we found a number of interesting points which we addressed in the technology, but also in relationships with national associations, NGOs, regulatory bodies, councils, ministries of health. There's a significant goal to increase capacity, and of course the 2030 universal healthcare targets require access to health by 1 billion people every 5 years, which is a significant number. So education, we believe, was going to play a big part in this, upskilling the workforce to be able to undertake more activities and more effectively. So the key areas that that came out through our assessment were really access to high quality peer reviewed education. There was a significant inconsistency and availability to the right education. There was also a lot of noise education around as well. I'll talk about how we achieved that, or the team achieved that, in a moment. Access to computers was also a big issue. Remote rural areas may not have internet connectivity. They may have low capacity networks, 2G networks in many cases, or no access to the internet. The other big issue really was the ability for content to adapt to the devices that were available. There was a massive inconsistency. Another significant area was around digital skills and people's ability to use and also desire to use technology. So that was a big consideration when we actually looked at the solution that we needed to provide to gain access to a large number of nurses, midwives, excuse me, and doctors. So what we did, we worked very closely with the regulatory bodies, the councils, a whole range of NGOs, national associations, and we developed a mobile application, so an app that was going to run on a smartphone. Nurses and midwives had access to smartphones on the whole, or they could get access to them. So all the content needed to be delivered on a device that could be accessed by the individuals, whether that's a PC or a smartphone. They also needed to be able to get the education and take it offline. We saw study patterns were not necessarily going to be when people had access to the internet. So a key consideration here was actually being able to study offline, but then also provide the facilities to the interested parties, visibility of progress, pre-tests, post-tests. Otherwise, there was going to be no ability to monitor improvement in knowledge and ultimately impact. In 2020, we launched on the 16th of January, which actually coincided with my birthday. So it was an interesting day. We launched in Ghana, and within about 3 months, we had 45,000 nurses on the platform in Ghana. We then continued to launch country by country. In total, we launched in sub-Saharan Africa into 28 countries, moving into the north of Africa and non-English speaking courses as well. From January to date, we've actually delivered 4.5 million training programs, which largely were in-app digital programs, not online through the PCs, although people had a choice. And that kind of validated the research we did in 2019. Around about 30% of those were actually taken offline with no internet connectivity. But we also believe a large number were actually taken offline as well, where there was poor internet connectivity. So a significant factor was the device that we delivered on and the fact that we made it available offline. Just to give you some appreciation of the size and the growth and the uptake, we've now got over 500,000 learners on the platform. Engagement is really high. What we're actually seeing is people are not just taking the mandatory courses, meeting their mandatory hours, maybe of 30 hours per year. We're seeing many of them study more than 100 hours per year. So why are they doing that? Well, we've researched that. We've put out surveys to actually find why there's such a high level of engagement. And it is largely to do with the fact that they can, but also that the education that's being provided has been peer reviewed and it's relevant. And that's been achieved largely by having around 50 consultants on the ground that are working with the association, working with the regulatory bodies, and more importantly, working with the institutions where nurses work. So there's a continual assessment. The feedback loop in the applications is really, really important. So there's a continual refinement of the education. So as nurses study, they provide what we call evaluation statements, where we get the opportunity to ask a number of questions about the education and its relevance. That information is fed back to the educators. The educators refine the programs, and we refine the learning paths in collaboration with the people on the ground. And in turn, that creates a role and a desire to study more. Simplicity is really, really important. ICT skills are varied in these territories. So the delivery platform has to be very, very easy to use and intuitive. What you will also see is people will help other people improve their ICT skills if they have the opportunity to do so. So how do you do that? You do that by introducing a community into the platform where people can ask questions and other people can answer them. Really, really key. There is no way WCA could answer every question out there to over 500,000 people. So the community has to help the community. And that is not only about how to use the platform, but how to get the most out of courses, what to request from the educators, the knowledge that they can request things or don't understand things. That feedback loop needs to be created. The platform needs to be, in my opinion, at least anyway, and I think this has been proven through the numbers, it needs to be multiple content types. So webinars need to be in the platform, static content needs to be in the platform, engaging static content needs to be in the platform, blended learning. But it also needs to adapt to the nurses and midwives' needs based on their current level of skill and their ability to use the platform. key considerations when understanding or thinking about how you deliver. So some very quick metrics. I could talk forever, I'm sorry, so I'll try and get some metrics out there that give you an indication of what can be achieved with this kind of approach. We're seeing a high level of course failure, still, at least pre-test course failure. So we do an exam before you take a course with most of our courses, and we're seeing somewhere in the region of 60 to 70% failure. In turn, after taking the courses, we're seeing a knowledge improvement average of 55%. So it's we know that the courses are having an impact as the improvement figures are actually being shown in the post tests. All of that information goes back to the councils, the regulatory bodies in a summary format, which gives them the ability to in turn determine what skills are not sufficient in the country, aligned with the country's needs. There's also been a demand, I think this is the last point I'll make, there's also been a demand through the high levels of engagement with the platform for additional content types. There is a desire for knowledge out there. Having up-to-date information is really important. But there's also a desire from the same people to have other types of content. Ebooks we've put into the platform, but we've also put in research papers. So we're working with a number of bodies on the research side, clinical research side, and we're now presenting that information into the platform. It doesn't gain any CME, CPD points, but people are still consuming it in high volume. Even though the information is out there on the internet and you can find it, by putting it into a central repository and application where people are engaging with already, gives them the opportunity to consume more and more information. That's me.
Thank you very much. Very impressive numbers, both on the outreach side and on the impact side. So great to see how you can get out to so many people and help them. So I think from learning what happened in the first section today, where we introduced the Padlet before the last speaker so that we could follow up on the inputs there, I think we will do that again. So Adriana, can you please share the next Padlet? So it is in your chat box now, so you can go in and answer the next poll that we have, which focuses on what barriers are there for frontline staff to increase their digital skills. So what are the barriers? So you can put that in while we're listening to our next speaker, who will look at best practice examples from India. So over to you, Emmanuel Blin.
Hello, good morning, everyone. I hope you can hear me well. So very happy to speak from Mumbai, actually, by coincidence, together with our CEO here, Sachin, Malhotra, we do most of the talk. I'm speaking on behalf of a company called Take Care for All. We are an SDG-free company focused on improving health in Africa and India. We run a marketplace for training healthcare professionals, which is called the Medical Learning Hub, and that's what we'll be talking about today. And I was asked to focus on India. I want to congratulate David for what he's doing in Africa. We are operating as well in Africa. All hands are needed on deck to clearly improve healthcare skills around the African continent, and more are actually welcome on that journey because the needs are absolutely immense there. So let's focus on India. I will share my screen and leave it to Sachin to actually talk about what we are doing in India. And that's it, my friend. Up to you. Can you see the screen?
Wait.
Well, yeah. Okay. Sachin, please.
So what we're going to talk about is give you a few examples, a few snippets, summary of what we've been doing in India when it comes to HCP skill development. So thank you, Emmanuel. So as a marketplace platform, what we've done is created a way for the healthcare providers who can be doctors, nurses, technicians across the healthcare spectrum, people coming in and taking opportunities to learn on either at their own pace through the LMS module that we have, or through attending on-site events, in-person training, or online webinars. So it's a marketplace that lets people access information related to medical training. And what we've achieved in the last couple of years in operations is we today have maybe about 800 plus training opportunities on the platform. We've been able to connect across India, pan-India, with 350,000 healthcare providers. We've been able to bring more than 750, close to 800 trainers, experts on different fields together, working with the healthcare industry, so about 20 industry partners that we work together in India, stitching together the different medical associations, the different healthcare NGO partners, as well as close to about 100 now medical colleges and hospitals. So like an ecosystem is what we are creating. And so just one sec, trying to move to the next slide. Okay, I got it. Yeah, so I'll just give you now examples of how we are working with all of these different partners together. So when COVID happened, of course, everyone wanted to quickly disseminate information related to their experiences, their protocols that are out there to healthcare workers in the front line. So we worked very closely with medical associations across the country, partnered very quickly with almost 45 state and national chapters of medical associations. And we made available the platform at no cost to them so that they could bring together their members, they could bring together experts and start talking to each other about the experiences. It was also international experience, Indian experience, all of that. So, so this was offered as one of our response. So then we also started working with the healthcare industry. And we understood the need of the industry to start connecting with and disseminating information related to treatment options, diagnostic options. So we started working with companies like Viatris, Medtronic, who had different needs. There was training needs around the ventilators, the use of oxygen, how to optimize that. There were training needs around information related to remdesivir, around the vaccines. So we worked together with all of these different industries to bring together several programs that that had experts as well as lots of different panelists from across the industry together. And what we created out of this was really a case study now that is being published as a white paper. So this shows one case study on COVID, how we were rapidly able to diffuse knowledge on the new therapies around treatment. Some of the key metrics of this was across the country, we brought together about 65,000 HCPs to attend these events. About close to 300 experts and trainers came together for the series of close to 70-ish events, webinars, and about 180 hours of clinical content was created in this whole process. So I'll move forward now. Another example which is related to the same time of COVID, but on a different context, patients were not able to travel to tier 1 cities from remoter locations. So tier 2, tier 3 cities, they still had hospitals there, but the patients were not able to travel because of COVID restrictions. So we worked together with Ethicon to create a model where surgeons in these tier 2 and tier 3 cities could be upskilled. And so we did several live online surgeries, training close to about 9,000 surgeons across the country in different areas. So yeah. Now, if you move post-COVID, the training platform, we still have several opportunities where people are interacting. We've now started conferences. So in the month of March, which coincides with the World Tuberculosis Day, we created this conference where we engaged close to 20 speakers from different countries also, a lot from India, several from the World Health Organization, a lot from neighboring countries to start talking about tuberculosis, how their countries are dealing with it, talking about innovative products that are coming into the market, which was very well received. This was a complete online program, a conference. And after this conference, we've now started doing hybrid events together with medical colleges, with other such organizations. And what we are also seeing is that users are now still engaging with programs. So we have a series of events going on tuberculosis, for example, which started last month, end of March, and till date we have close to about 2,500 healthcare practitioners who have attended it. So it shows continuity of engagement into each of these programs that are online. Last, want to share an example which is not related to infectious diseases, but more, so this is around oncology. So we're doing a series of events around breast cancer and prostate cancer, not just in India, but across. Sorry, I think.
Yeah. Are you able to hear me? Bit of an echo, but we're okay.
Hello?
That's fine, carry on.
Okay. All right, so we'll just mute the other computer. Just give us a second, please. Let me share my screen.
Yeah, it should be okay now.
Okay, so I hope you can see my screen.
Yes. Yeah.
Sorry, dealing with Wi-Fi problems. Yeah.
That's okay. This is global. You get a free pass.
Yes, so we've now moved into the oncology space, also bringing together different medical associations, different KOLs across the country, and actually extending this to Africa also. So India, neighboring countries, and Africa, where we're doing a series of CMEs on education, educating the frontline workers. So that's about it. Wanted to leave you with an impression of how KOLs, the experts, the trainers, and individuals healthcare practitioners are viewing our platform as. So yeah, I'll just leave it the screen now. Okay. Happy to answer any questions, Emmanuel. If there's anything, yeah.
Thank you, Sachin. I think lessons learned are all about quality of UX, UI, very important. Content, speakers, continuity, and we are now living in a world of hybrid engagement. So we need to think about training, including the physical and the online worlds together, and integrating them to provide the best possible experience to HCPs. So we all want to see each other again, but online training provides a level of convenience that people got used to through COVID. So we should really now move into a world where we blend both online and on-site together into meaningful programs that really engage HCPs around upskilling themselves. Thank you.
Thank you.
Thank you very much, both of you. Definitely interesting to hear how things develop and we bring out to more people and within more fields and really getting out there to help lots of people with their digital skills or skills for health in general. Thank you very much. So Adriana, can we put on the results from the Padlet that I've looked at? You're very good at putting in new input. So thank you very much, everyone, for everyone bringing together their input to this. So I've looked at them a little bit, and what I see is, of course, time. These are busy people. They're already under a lot of pressure, these healthcare staff, frontline workers. So how do they get the time to increase their digital skills or skills for health? There's also some people mentioning access to support. This was also something that Louisa mentioned. How can you get the support when you need it? And how can you feel secure in what you're doing and get the knowledge that you need? We're also seeing resistance towards digitization and management support, which has also been mentioned before. and just understanding why we're doing this, why we're using these solutions, and how it will help both the staff and the citizens. So lots of good answers here. We will also share the Padlet results, just like we'll share any presentations that we've had and the video from this event. So all of this will be available afterwards on our Skills for Health page on the ECH Alliance. But I think we're ready to move on to our last point of today, our last section, and I will hand over to you, Andy.
Thank you very much. I think just to sum up a couple of things, I'm just sat here absolutely speechless by what I've just heard, and that's a rare occasion for those people who know me well. This is where they shake their heads. I'm speechless because I'm seeing here coming together. We've seen some fantastic practical examples of where industry stepped up to the mark, seen a gap, a need, and met that need internally with a Connected Health, Connected Academy program. I thought that was fantastic. So thanks to Teresa with that. I think we've seen some great expertise again from South Denmark, from Randy. So thank you for that. I think that was just a really, really useful way of exposing some practical, actual tangible statistics around deficits in skills for frontline staff from the Erasmus program. That was I think was just great, and I hope we've captured that. So thanks for Randy for that. I think we've also seen great practical examples, obviously not just from Connected Health, but also from Anne from the Aged Care Tech Council, because I think that's that similarity between continents is great to see, but also scale and pace both within Africa and India is mind-blowing, because I'm looking at this. This is where I started work, and I'm thinking, why can't we replicate this? So we've got hopefully I think we've got a teeny weeny bit of time for discussion. I'm happy to see if we've got any Q&As that are still open. So Lee's asking questions about, is qualitative research being included for more information? So perhaps someone can answer that in the chat function. And then also we've got a question from Lee as well. Oh no, it's actually just a comment from Lee. So I think it's just, if people can come back on some of Lee's questions, that'd be useful. I wanted to see if we've got any other questions, but I'm quite keen. We talked at the beginning of this session to say what a thematic ecosystems around matching need and solution. I think we've seen that in large quantities today, from the excellence from our panelists, from Sachin and from David as well, the WCA. I think what I want to do, we always run out of time with these things. So I'm gonna come to what is, I think, the exciting part for me, which is a pitch session. Now we've brought together two, hopefully some interesting pitches from two companies, one of which is called Vaccination and also Vantari. So I'd like to ask our first pitch presenter, who's Luke Rinahan, who's the CEO from Vaccination. If you're ready, Luke, just show yourself on the screen, because I can't see at the moment. So I'm not.
Hi Andy, nice to meet you.
Nice to meet you, Luke. Now then, we've got a luxury today of having some time. So you've got 2 minutes to talk about what you do.
Fantastic.
And what's relevant for other people here, because you've got here industry professionals from across the globe, from all the way across in Australia, obviously, all the way through Africa and India and through Europe. And I know we'll be repeating this with our colleagues in Canada and the US, because there's strong interest there. Just so you're aware, and to put even more pressure on our pictures, we record these and ship these out to the rest of our global audience of 23,000 people, all the way from Argentina to Canada, back over to Australia. So no pressure there. You've got 2 minutes to tell us about what you do and what's the point, and more importantly, what do you need? Off you go, Luke.
Yeah, thank you. I appreciate the opportunity. Let me just share my screen and bring up a couple of slides to share with everyone. So I'd like to start off by introducing you to an absolutely incredible lady named Jan. She's been an immunization nurse for over 25 years. She was also involved in vaccine research, working on the human papillomavirus vaccine. But the most awesome thing about Jan is she's actually my mum. And this means I've spent most of my life getting jabbed by literally any vaccine she could get her hands on, and hearing about all of the challenges that frontline immunization teams face just by asking her how her day was. So it was on the 4th of April, 2020. I just returned from 5 years in Europe as COVID's beginning to spread across the globe. And I'm sitting on the couch in my last day of quarantine when I get a call from mum, and she says to me, "Can you help with social distancing for our immunization sessions, or services rather?" Because these community vaccination clinics that she was involved with had large wait rooms and long wait times. Then the school and aged care vaccination programs and workplace programs had excessive amounts of handwritten paperwork that was then manually entered into old, outdated systems that look like this. And then when a patient finally reaches an immunizer, there's extensive amounts of briefing time and additional medical questions that they need to answer to then assess their eligibility to receive a vaccine. So it's just a really long and inefficient process. But of course, my biggest concern, having seen how rapidly COVID was spreading across Europe, was that my mom, as a frontline worker, would get COVID just by going to work each day. So I began researching, and what I found was there was a much bigger immunization challenge ahead as well. Each year in Australia, there's close to 20 million visits to an immunization provider, but with the addition of a COVID mass vaccination program, they would need to find the capacity to deliver over 3.3 times the amount of visits to an immunization provider each year. And this truly is a global challenge. You can see there some of the numbers just for England, where I know a lot of you are tuning in from today. So the problem that providers needed to solve was how to vaccinate more people in less time with less cost, how they could remain compliant with things like legal compliance in Australia with compulsory reporting to the Australian Immunisation Register, but other areas like cold chain management compliance as well. And then finally, around client experience, how you can make your service more accessible and ultimately improve the uptake of all types of vaccines, whether that be a HPV vaccine or a measles vaccine, as well as those COVID vaccinations as well. So this is where the idea for VaxApp really came about, and where we are the solution. We developed the world's first immunization eligibility engine. This takes into account over 30 different data points from a client's profile, including their age, their medical conditions, their previous vaccination history. This automates the suggestion of what vaccines they're eligible to receive and when they can actually have those. It even prompts the purchase of additional paid vaccines where a patient is eligible for those too. And then it follows them up with reminders throughout their entire life to be vaccinated on time when they do require those specific vaccines based on their medical profile. This has been so effective with one of our clients, the City of Greater Bendigo here in Victoria, Australia. We've doubled the uptake of meningococcal B vaccines with their Indigenous community. And it also powers a lot of the automation across the platform too. So another one of our public health services clients, we've enabled them to actually triple the capacity of their school vaccination program in Victoria here as well, to catch up on all of those missed school vaccinations during lockdowns that we had here. So the industry average vaccination time was roughly 6 minutes for a COVID vaccine and 4 minutes for a flu vaccine here in Australia, depending on the delivery setting, whether that be a pharmacy, a workplace vaccination program, or perhaps a community clinic. We've been able to reduce that for COVID vaccination down to 2 minutes and 1 second. That was for a Department of Health Australia workplace COVID vaccination pilot program. And also a nurse with less than 20 minutes of training. So we heard a lot about the training requirements of frontline workers. With less than 20 minutes of training on VaxApp, was able to deliver a flu vaccination, everything from end to end within a minute 46. And dozens of the providers using us across Australia are seeing these kind of efficiencies with those vaccination programs. So we're now a team of 20 working towards this mission to improve health services and prevent the spread of infectious diseases, and support the essential healthcare teams that are delivering those services around the world, just like Jan. My name is Luke. Thank you very much for the opportunity to share VaxApp with you today. We are working towards a UK and EU expansion later this year. So if anyone on the call or in your network is looking to improve your vaccination coverage rates and support your frontline immunization teams, I'd love to hear from you. Thank you.
Thank you for that, Luke. And I think you've got a very, very targeted audience and an ask there. So what I'm going to do is I'm going to come back to that specific challenge in a moment. Thank you for your information. I always think it's great to have a why, and you've got the why right at the beginning with your mum. So fantastic. I'm going to hand very quickly now because we're conscious of time. And so well done. That was really, really, really useful, Luke. I'm going to go now straight over to Nish Krishna Nathan, who's from Vantari. I hope I've pronounced Vantari right, Nish. If you could show yourself and I'll hand over to you.
Thanks, Andy. Thanks, Andy. You've done a great job pronouncing my name, so I appreciate that. I'll just share my screen.
No problem.
We'll just make sure everyone can see this quite clearly. Awesome. All right. Thanks, everyone, for sparing your time. I won't take up too much at the end, but good morning, good afternoon. Good.
Pause you. We've got a dark screen, so you might have to switch between the screens. It says PDF, nothing else.
Let me try it a different way.
I'll stop the clock.
No. How about I leave it like this? I'm not too fussed if it looks like this. There we go. That's perfect.
That's fantastic. Off you go. Your time starts now.
No worries. Yeah, thank you. All right. Good morning, good afternoon, good evening, everyone. Thanks for having Vantari here today. And my name is Nish, as Andy rightly pronounced. I'm a surgical doctor by background. Spent 10 years as a clinician here in Australia, predominantly in Sydney. I'm the co-founder of Vantari, which is virtual reality training for healthcare. We help clinicians, nurses, students practice life-saving procedures in a safe, scalable environment before performing them on real patients. And our mission at Vantari is to eliminate medical error and save lives in the process. Medical error is a huge problem. It's a $1 trillion problem in the US alone, and 10% of it is attributed to medical procedures. It's something we can do better with. We can improve on mannequins, cadavers, subjective training, and really form a standardized way of training clinicians and nurses moving into the future. And I think there's never been a more important time than this whole COVID era or post-COVID era. I myself have been on the training end. I have delivered procedures, and I've seen medical issues occur from the simplest of things, whether it's someone leaving a guide wire in the patient or someone giving the wrong medication like anesthesia in a procedure. And I think these are all preventable errors that we can do better with. This was the biggest reason that my co-founder and I founded Vantari in 2017. Our mission is to eliminate medical error. And like I said, it's all about helping doctors, nurses, and students practice life-saving procedures. Now, for those who haven't used virtual reality before, how does it work? Well, look, it's like an app on the App Store. We're hardware agnostic, so we run on a VR headset and laptop. Once you pop on the headset, you can perform a multitude of clinical procedures. And we focus on all the way from fundamental things like an intravenous cannula, all the way to more complex procedures like chest drain, central venous catheterization. You're in a lifelike medical environment, and there's steps according to college guidelines. So we're actually delivering best practice training according to either hospital guidelines or national guidelines. And along every step of the way, there's performance tracking. So it's giving you real-time feedback on how you're traveling, and it acts as a bridge between never having done a procedure to finally doing one. Currently, the hospitals, universities, and medical device partners that we have, they use it as a bridge for training. They say, do 5 of these on the Vantari system before you come and do it on a real patient. So this means we can achieve proficiency quicker and more standardized, but also prevent de-skilling. I know if I learned a procedure and I haven't done one for many years, it means I've completely de-skilled, and I don't want to be doing it on the patient for the first time after that many years. The other great thing that virtual reality can deliver is scenarios and complications, something that's extremely difficult to do on mannequins, cadavers, and you don't want to be practicing that on real patients. The other opportunity as we grow the platform at Vantari is using as a digital logbook, and in the future, an accreditation platform with the colleges and universities supporting it. Usually I would play a video, but I'm not going to do it due to bandwidth issues and all the rest. But if anyone wants it, I'm happy to send it across just to show how it works. But these are 3 nice pictures just to show you how it all comes together. You log in through your computer on the laptop on the top left there, you pop on the headset. You can then see the steps, as you can see there in the middle, and then you perform the procedure. And we've got things like a virtual patient, whether it's female, male, adults, neonates, pediatrics. We've got ultrasound, dynamic monitoring, and all the rest. And you can imagine trying to run these procedures in real life where you need large amount of overheads, resource utilization, and all the rest. But here you can do it in VR with a headset with a 2x2 space. And on the right there, you can see how you perform. It gives you a nice breakdown, almost gamifies the whole thing for clinicians and nurses. And we're often getting screenshots of their best time, which is probably not the marker of success, but it's a nice way of getting them engaged with our software. We've done studies in Australia to look at how much we can reduce medical error by using our platform. So if anyone's interested, I can send this study later, but we found a 40% reduction in medical error after using our software. So something as fundamental as arterial blood gas in terms of university training. At the moment, we're in 7 organizations across Australia. We have global ambitions, but we started where we're based. And we've had the likes of Royal Prince Alfred and other tertiary hospitals use it for training, both from adults all the way to pediatric training. We're really lucky to have hundreds of clinicians using the platform weekly. And for us, since we've grown from 2017, I think it's nice to see a place for virtual reality in training and healthcare. Our team is just over 10 now. The founders, myself and Vijay, founded in the middle of 2017. I come from a surgical background, Vijay from an emergency background. We've been very good mates since we started medicine. We're stuck at the hip ever since, despite the 1.5 meter distance that COVID had provided. And we found Daniel early into the piece as our CTO. So he's got about 20 years of experience in VR, AR, and 3D systems. And the rest is a range of software developers, programmers, all based around Australia, as well as BD managers that are help growing the platform here locally. Been supported nicely by clinicians across the board in multiple specialties. Despite Vijay and I being clinicians, we always rely upon key opinion leaders and people who are really driving training in the ecosystem here and overseas. So that's helping us clinically validate the software. Quick snapshot of the journey, so I don't waste too much time. 2017, founded the company, been supported by local and federal government grants here. Got an international award as well last year through Epic Games, which was fantastic. And then throughout the way, just collaborated and formed great partnerships with tertiary hospitals, universities, and then medical device companies as well. So why am I here to talk to you all? There's a great opportunity to use VR to train both in the first world and third world. We've been lucky to start some pilots in Kazakhstan and Nigeria, out of all places, but there's been great growth and appetite for clinicians, nurses, and students where you can scale the technology platform much quicker than you can in any other resource. And it's the perfect time to deliver training. And we hope that the way we're traveling, that people can actually train at home before they ever step foot at a hospital or a university.
Right.
Thank you. Please feel free to get in touch with me.
Fantastic. Next, I would advise that last slide, slide 13, is your nail it slide. So keep that one and put that one at the beginning. It's fantastic, that last slide. Okay, fantastic for that.
Thanks, then.
If you can, we'll share your video via social media as a follow-up. I'm conscious of people's time. We're running a slight bit late. I'm going to set a challenge, okay? We've heard some fantastic examples today from across the globe. You couldn't get a more global audience than we've got today. Fantastic in terms of our input. My challenge is, so what are we going to do? So I'm going to invite potentially all our speakers who spoke today to come to a follow-on call, which I will try and arrange to suit time zones, etc., to see where we can collaborate a little bit more. That's going to be enough from me. I'm going to hand over very, very quickly using the power of, it's over to you, Karen. Over to Karen.
Great, thank you, Andy. I'd also like to thank each of our speakers tonight for such fantastic presentations. I found them really interesting, engaging, learned so many new things in this area, and I'm very appreciative for each of their time. I also say thank you very much to Nish and to Luke for their 2 pictures that they provided today. Nish and Luke are both partners of RMIT University, and we're very pleased to be able to bring them into tonight and be able to share the fantastic innovations that they have with you and with the whole world. So that is from me being the lead hosting tonight with our partners in Denmark. I'd like to hand over to Caroline to talk about our next Skills for Health event.
Thank you, Karen. Yeah, so as Karen said at the beginning, we focused on citizens and carers. This time it was frontline workers. Next time we're going to look into managers. I think from the first presentation we had today by Randi, she underlined how important the role of managers are when it comes to increasing the digital skills. So that is what we'll focus on the next time, which is on the 22nd of September, same time. I'm not going to say the times because they're different for all time zones, but we will share it just like we have this time, and we'll share it by email to the people who have participated. So hope to see you again in September, focusing on managers this time. Thank you.
Thank you. Thank you, Caroline, colleagues from South Denmark and colleagues from our RMIT in Australia for your help and assistance with today, and my colleagues Adriana and Ines for making this happen. Thanks for all of you for turning up. We'll be sharing this via social media, YouTube, Twitter and LinkedIn, and every other funky thing you can think of. We'll be in touch and speak to you in September. Thank you. Bye-bye.